The Muslim National COVID-19 Response Team, after consultation with Muslim scholars nationally and internationally, and the Ministry of Health, has developed procedures related to the handling of the body of the dead or presumed coronavirus victims, conducting of the funeral prayers and burial procedures, which emphasize on preventive measures and prevention of infection. The following measures have been put in place. A team of volunteers in Nairobi, Mombasa, Eldoret, Nakuru, and Bungoma have already been identified and established and have undergone the necessary training on handling of the dead, the deceased, cases of COVID-19. The volunteers with appropriate personal protection and equipment will provide assistance in handling the disease cases and will ensure that the bodies of Muslims will be wrapped in white sheets and placed in biodegradable sealed body bags before being transported to the burial areas. The dignity of the dead will have to be appreciated. We are concerned with what we saw happening in one of the counties yesterday. It has been unanimously agreed that Muslims who die as a result of COVID-19 will not be subjected to the traditional rituals that take place. This is to prevent possible infection and spread of the disease. Normal procedure is that a Muslim undergoes 4 stages. One is the cleaning of the body, and the second one is to shroud the body in a designed sheet or clothing, and the third one is to pray for the dead body, and finally the fourth one is to bury. We will now only possibly pray for the dead on the graveside or pray in absentia of the body. This is all to avoid the infection. All home deaths have to be reported through the toll-free number provided by the government, that is 719, for the government to assessment before the team engage in the burial procedures of such cases. In the event of death caused by COVID-19, either at the hospital or at home, a team from the National Muslim COVID-19 Response Team Committee will be at hand to provide necessary assistance regarding the handling of the body's transportation and burial procedures. So this committee is providing, we have volunteers who are already trained, and they will be supporting this process when it occurs, definitely with the assistance of the government.